I'm a psychiatric nurse, and early in my career, I worked at a residential mental health facility. One of our residents was an elective mute, which means that he couldn't talk. But there were no medical reasons as to why. He had spoken earlier in his life and in fact seemed quite normal back then, with the exception of being close to 7 feet tall. He'd been raised in the Deep South and joined the military when he was 19, but one night he vanished. He was declared AWOL, and eventually he was declared missing and dead. 10 years later, a 7-foot-tall man walked into a hospital emergency room in my part of the Midwest and said to the receptionist, "My name is Marion Duchesne, not the real name, and I've been dead for 10 years. Those were the last words he ever spoke. He was covered with dust, and he was wearing the same clothes he'd been reported to be wearing the night he vanished. His social security number had not been used, and he had no identification on his person.